let's talk about our parameters with light therapy. So this is a typical light therapy kit. So you would have the device, which this is where we would set our outputs and our dosages. You have the actual lasing laser device. So this is what we call a cluster probe. So each of these little holes is a single laser that comes out. And this is a point laser where we just have one single. So those would have different purposes. So on our device, we have just the cluster probe. You have your power source, and then you have your eye protection. So the effect of the laser is dependent on the amount of energy that it emits. So again, we're not dealing with high energy lasers. Those are our class 4s. Those produce heat, and that would actually damage tissue. That can be used in surgery and for other purposes, but not in what we're calling our low-level light therapy. Our low-level energies, lasers do not heat up the body tissues, so they're for our therapeutic purposes. So the parameters are going to depend on the delivery technique we're going to use. So do we have that single laser probe, or do we have a cluster probe where we can do kind of a larger area? The dosage of the treatment, so the amount of power we can produce, as well as the duration, so our length of time, and the amount of tissue penetration we can get. So that's typically wavelength dependent, and that's usually specific to the type of laser you're using. So let's talk the delivery techniques first. So the laser probe should be in contact with the skin, or again, if it's an open wound, we would cover that with an occlusive dressing, or if you don't want it, covered, which I would just cover all the time, the sterile transparent film. You can also hold it maybe like as close to the skin as possible, so less than about 1 centimeter away, but just put the occlusive dressing on. That's the best choice. For small areas, you can use the single laser probe, which we see here. And then for larger areas, we can use these clusters, which again means that each of these is a diode sending out an individual kind of laser beam. If the cluster probe is not available and we're trying to use a slightly larger area, then we have to do either what we call the grid method or the scanning method. So for a grid, we literally take the size of our laser pointer, okay, the laser probe here, so it's usually about 1 centimeter squared, and we grid out 1 centimeter squared segments. And so we do a treatment, move to the next spot, move to the next spot. Now that seems ridiculous, but most of our laser treatments are under a minute long. So from a minute to like 2 minutes and 30 seconds. So it's really not that long to have to sit on any one spot. We can also do a scanning where we slowly move the laser probe around a little more like ultrasound. So usually you go one direction first, so you move one direction, and then you would do, as you come across the next time, you go 90 degrees to that first path, and you go slow and steady. You would have to increase your treatment time to increase for the area that you're trying to treat. So that's really important as well, that the dosage is really based on that treatment time, how much light we expose during that time. And so if you're doing a larger area than just the area of your diode, your treatment time has to increase for each time you are moving that device. So for example, with like trigger points, slowly moving the laser probe, maybe getting a little bit of pressure down, a little massaging effect, could be beneficial as well. But again, you have to know how big your area is so that you increase your time that you're needed. So let's talk the dosage, which is the amount of energy applied to the tissue. So the power density of the treatment is expressed in milliwatts per centimeter squared. Okay, so that's our typical thinking about the power for the area. So that we look at actually the laser output, which is expressed in milliwatts, and our surface area, which is centimeters squared, and the area of the laser that is actually emitting the energy. So we determine that, okay, and joules and milliwatts are kind of used interchangeably. So some machines will do milliwatts, some machines will do joules. You just gotta kind of know your machine. So the laser output, again, can be described in joules or described in milliwatts. So we have this calculation where we have again, our joules per centimeter squared is our average power times our treatment time divided by our treatment area. And so the way laser is set up, it kind of depends on your machine. But usually either your manufacturer will have kind of a list of typical dosages, maybe the research that you're pulling from has typical dosages. And you got to know, is that dosages per centimeter squared, or are you just given the power and then you have to do the math here? So these are some examples of typical treatments that you see based on the amount of power over the area. And sometimes it's called just point, and that's typically the same as centimeter squared, because typically that one single point is a 1 centimeter squared laser probe. But meaning that if you have multiple areas of tendonitis, you'd have to do 1 to 3 joules per times you move around. So you got to kind of think about that. Whereas if you're doing a cluster probe that has a larger area, that would affect potentially your dosage as well. So like superficial wounds, you can also, this is a pretty large range here. You start lower, and then as the wound bed develops over time, we get usually larger. Trigger points, we could use that probe. So this would be 8 joules per centimeter squared if you're using more of a cluster. It could also just be 1 joule per point, you typically see as well. Nerve roots, again, if you're using a probe, it would be really like 1 to 3 joules per point. If you're using the cluster, it's more of the 8 to 24. So just some typical kind of examples of things there. So again, your treatment area is going to be the area of the laser beam or the area to be treated, and that's going to be in centimeters squared. And so that's going to end up affecting our power or our treatment time. And so typically our machines let you, the power is either set or you have very distinctive power outputs that your laser can do. So sometimes you can set a couple different ones, or it's just one set. So this is usually going to be set by the machine. Your treatment area you're going to determine, but it's potentially the size of your probe. So if you just have a single point probe, or if you have that cluster probe, and then if you're going to do multiple of those, you would have to take that into account in your treatment area. And then that's going to affect your time. So you can either usually set your time, or you can set your dosage if you have a chart, or if your machine gives you certain dosages or the research. So if you set your dosage, usually the machine will automatically set you your time based on the area that you selected, as well as your power that your machine can do. If you're not setting dosage and you set this, it will come up with your dosage for you. So again, just another chart of different research, and you see these numbers are a little bit different. These are in joules, so this does not take into account centimeters squared. So you got to think about that with your treatment area as well. This is just another example from your book of example dosages. So for tendinopathy, sprains, or strains, if they're more acute versus chronic, we can increase. Again, these are in joules. So the applied treatment dosage should be based on the density of the energy, which is going to be with centimeters squared. So we'd have to think about the area as well as the energy being produced. So again, treatment time, when we're looking at especially our machine here, the power is fixed by your machine or by your laser. Again, there might be 2 or 3 options, or you're going to be set with your power. So also remember that this is going to potentially be affected too by wavelength. So the longer your wavelength, the deeper, the more power, usually the deeper as well. So to alter dosage, we typically alter our treatment time. So this is just a rearrangement of that equation that we have up here. And so, because most of the time, the treatment time will actually be something that you potentially have to set, because you use your dosage from charts, you know your treatment area, and you know the power of your machine. And so we get the treatment time that you set there. So if we have a dosage of 1.5 joules per centimeter squared, our power is 0.5 milliwatts, and we have an area of 0.5 centimeters squared. When we put all that into our equation, we get a treatment of about 300 seconds, or that's 5 minutes. So that's just an example of how to do this work. So when we get into actually doing our machine, you're going to have the potential of setting your own, just like we typically do a manual. And you'll also have the ability to use some of the preset standards that your machine comes included with. So another example of this. So if we have a treatment dosage of 5 joules per centimeter squared, we have our average output of 1 milliwatt over a 1 centimeter squared area. So this is where we would be doing more of the probe versus the cluster. So the total treatment time would be 5 joules divided by 0.001 watts. So we got to convert it to watts from the milliwatts here because that's what's going to keep it in line with the joules, times 0.01 centimeters squared. And we're going to get about a 50-minute treatment for that. So dosage for acute conditions are typically less than 0.5 joules per centimeter squared, while our chronic conditions get closer to 3 joules per centimeter squared. Again, research is going to show different things. Your machine might have different protocols. The biggest thing to remember is think back to the Arndt-Schultz principle, right? You have to have enough energy to actually target the tissue that you want. And so again, for acute, we can typically get away with lower ones, whereas our chronic, we need more of that energy to be able to target what we want out of it. So let's talk depth, our tissue penetration. So again, this is related to both wavelength and power. The shorter the wavelength, the lower the depth of penetration. The longer the wavelength, the higher the depth. So if your laser is more in that 800 to 1,000 nanometers, you're potentially getting a little bit deeper penetration than you would with something shorter. Right now, the research-wise, kind of deepest for the direct effects, again, we're maybe up to those 2 centimeters if we have the right type of lasing medium to get some of those. Indirect can go a little deeper. Some research shows that it's maybe only 3 to 5 millimeters even with the direct effect, and then you go a little bit deeper with the indirect. So again, kind of depends, but it's safe to assume, based on the wide variety of things that go into this, that your direct effects are probably only going millimeters deep, and that your indirect effects are maybe taking you centimeters deep. So it's pretty superficial. So again, those direct effects, this particular study that I found was saying that it's only 5 millimeters at most. We see from other sources in our book that those could be deeper, 8 to 15 millimeters, even up to maybe a centimeter or 2 centimeters in our direct. It's better to just err on the side that it's probably much more superficial than you're thinking. Things that would also affect penetration is the type of skin. So darker skin is going to absorb more light at the cutaneous level, which is going to then stop that from penetrating any deeper. So darker skin has more melanin in it at the very superficial levels. So a lot of that light energy gets lost. So they haven't done as much research on treatment of darker skin. So that's something to be aware of. And then large levels of subcutaneous fat would also hinder. Again, we're superficial, and so we're not usually trying to target the fat. We want to be in areas with a lot of blood flow so that the hemoglobin can be affected, and the COX enzymes and those kind of things. So again, subcutaneous fat layers are going to affect the tissue penetration as well. So let's wrap up our talk of parameters with our overview of evidence. So it's difficult to make an informed decision because there's so many methodological issues that happen. The wavelength of the laser, the type of the lasing medium, the depth of penetration, the type of the skin, the type of tissue, the power outputs, all those things have to be controlled in order for the result to happen. And research is just so mixed on what devices people are doing their treatments on, and so it's hard to make decisions across the board. Another big issue is that healthy tissue doesn't appear to react to the laser energy, so it's harder to use healthy individuals as subjects, which means you have to recruit injured individuals, and those are just harder to come by, so those research hasn't been done as much. The findings, again, are very specific to the type of laser, so the medium inside of the laser. So here are some very different results for very different lasers. The gallium arsenide seems to have shown, promoting muscle healing. Helium neon, when applied 2 days post injury and applied at 48-hour intervals, was more effective. Helium neon and again the gallium arsenide, um, with a standard treatment protocol on pain and range of motion, showed that all three groups improved over a 2-week period and the lasers had no significant benefit. And so the research just really ends up being mixed. Two really early meta-analyses, so done early 2000s, which is early for the light therapy type of research, showing that treating orthopedic and skin conditions strongly suggests that it's not an effective modality. And it's because of all those different mixed results and which type of laser and things like that. So that's going to be the tricky part of determining if light therapy is for your patient, is the evidence is really mixed.